This is Real News Media TV, coverage you can trust. Please like, share, subscribe, and hit the notification bell. Select all for daily news updates. PNP knocks the government on face-to-face school. The opposition People's National Party yesterday accused the government of dilly-dallying with the education and the future of the nation's children by not yet deciding when it will reopen schools for face-to-face classes. At a virtual press conference to discuss the state of education in Jamaica, PNP junior spokeswoman on education, Rasheen Roper Robinson, challenged the government to do less talking and put something concrete in place for schools to reopen. She chided Prime Minister Andrew Holness for stating that vaccination is the only way to go if students are to return to the classrooms for face-to-face lessons, and told him not to apply such a one-size-fits-all approach towards citizens. UNICEF has been calling on the government to put something in place for schools to be reopened. At this point, there needs to be a drastic movement beyond discussions, cabinet meetings, and subcommittee discourse. I am not sure what is coming out of these meetings, Roper Robinson said. Martin Luther King Jr. spoke about education's function being to teach one to think intensively and critically. Education that stops may prove the greatest menace to society. The government has clearly strayed from thinking of what the role of education is supposed to be because they are having too many meetings, discussions, and looking at proposals. Nothing is being done as it relates to the students returning to the classrooms so that society doesn't become filled with menaces, she said. The party's spokeswoman on education, Angela Brown-Burke, raised a concern that many children are not absorbing lessons taught online for reasons including domestic violence and mental health problems. There is the issue of domestic violence, physical and mental health problems, particularly with individuals who are locked up at home with their abusers. With the intense tension in the family, teachers and caregivers are often moved to deal with the manifestations at school, even without all the necessary professional resources. This sometimes leads to emotional exhaustion and the teachers feeling emotionally overwhelmed and stressed, she said. Trial of former Petrojam executives to begin today. The trial of former Petrojam General Manager Floyd Grindley and the former chairman of the state-run entity, Dr. Percival Bahadur Singh, is scheduled to begin today in the Kingston and St. Andrew Parish Court. Mr. Grindley was charged with 8 counts of aiding and abetting and obtaining money by means of false pretense. Dr. Bahadur Singh has been charged with 12 counts of obtaining money by false pretense. It is alleged that from December 2016 to May 2018, Mr. Grindley aided and abetted Dr. Bahadur Singh to fraudulently claim disbursements from Petrojam amounting to US $73,620. Second dose vaccine slump. Fewer Jamaicans have been turning up for their second dose of COVID-19 vaccines, even as the government pushes to administer 1 million doses by the end of next month. Yesterday, health officials pleaded with Jamaicans who are due their second dose to come forward. There is a decrease in the take-up of doses. Many persons are still due their second doses, and we are seeing that we have less persons coming out. We started the first week with 38,000 persons coming out for second doses, and the last week we only had 8,607 persons who came out for their second doses. Chief Medical Officer Dr. Jacqueline Bessie McKenzie said during the ministry's COVID Conversations news briefing. More than 50,000 people are still due their second dose. The new take-up for the shot has also dropped, Dr. Bessie McKenzie said, pointing out that October started off with more than 12,000 people taking a first or single-dose vaccine, but this decreased to under 10,000 by the second week of the month. She warned that people are not fully protected unless they have taken a single-dose vaccine or both doses of a double-dose vaccine, stressing that of the 1,651 COVID-19 related deaths in the country between March 1 and October 24, a total of 98% of them were unvaccinated individuals. The CMO and Health and Wellness Minister Dr. Christopher Tufton stressed that with the vaccine sites now bumped up to over 200 locations, including fixed, mobile community outreach and private sector initiatives across the island. In addition to drives focused on shut-ins, there is adequate opportunity being provided for people to get vaccinated. Additionally, the minister announced 100 private doctors have been brought on board to administer vaccines at their facilities. There should be no excuse for anyone who wants to get vaccinated. There are options, and the excuse that was given in the past that we need to provide more outlets is no longer the excuse that can be given with credibility among persons who have not taken up the vaccine, he argued. There were 49 new deaths from COVID-19 on Monday and 2,184 deaths overall since the pandemic hit the island in March 2020, the ministry advised. The country has recorded a cumulative 88,480 confirmed cases, with 512 persons now in hospital. A total of 56,944 people have recovered from the virus. The CMO noted that the country's vaccination level is still too low to have any positive effect on transmission at this time. She said while the daily positivity rate is now 8.3%, more than 3% above the World Health Organization's recommended level, there is still significant pressure on public health system, with 400 hospital beds occupied by COVID-19 patients and 46% of communities affected, with new cases over the past 2 weeks. Sunday no movement days discontinued, daily curfew from 8 p.m. to 5 a.m. The government of Jamaica has discontinued Sunday no movement days. Prime Minister Andrew Holness has announced that the new curfew hours will be 8 p.m. to 5 a.m. daily. The new curfew takes effect on October 29 and will last until December 10.
So there will no longer be a no movement Sunday or a no movement day. This new curfew will remain in effect until the 10th of December 2021. I will have some consultations with interest groups, and I will definitely call up the leader of the opposition early so that we can have a consensus as to what to do in Christmas. So this is the holding position for Christmas. However, Madam Speaker, we will reconvene our Cabinet's COVID subcommittee to review these measures in 3 weeks' time, and depending on the level of increase in our vaccination rate and the continued decrease in the positivity rate, then we could come back with even better news. The gathering limits, Madam Speaker, there are no changes to the gathering limits at this time. The general public gathering limit remains at 10 persons. Places of worship will continue to be restricted to having no more than 50 persons in attendance. No crusades, conferences, or conventions are permitted. There is also something this is also something we intend to review again in 3 weeks, along with the curfew hours. The number of persons permitted to physically attend a wedding remains at 50. The limit on persons physically attending annual general meetings remains at 50. Physical attendance at events hosted by public entities is limited to a maximum of 50 persons. And Madam Speaker, these events that are held by public entities are to be controlled events, meaning that the space within which the event is kept, all the protocols must be observed, but it is not a free access space. And the reason for that, Madam Speaker, is that attendance at these events must be for the vaccinated only. So Madam Speaker, in this order, public sector entities that are putting on events must first determine the vaccination status of those who they are inviting to attend. Madam Speaker, the existing work from home directive in the public sector remains in place until December 9th, 2021. As a precursor to returning to work, permanent secretaries and heads of agencies must put in place measures to ascertain the vaccination status of staff in the public sector to facilitate risk assessment and planning. So, Madam Speaker, the permanent secretaries are now directed that they must determine the vaccination status. Ascertain, a nicer word, but after ascertaining, they will make the determination. They will find out the vaccination status of the workers in their charge. And this is to help us now plan for the endemic stage of the management of the disease. Funerals and burials. Madam Speaker, there are no changes to the existing measures regarding funerals and burials. Funeral services are permitted with a maximum of 20 persons physically present, including mourners, clergy, and support personnel. Burials are permitted on Monday to Friday between 9 a.m. and 4 p.m. with a maximum of 15 persons present. As a reminder, burials are not permitted on weekends. So, Madam Speaker, let me speak quickly on infirmaries. We have not spoken much about them. Our vulnerable citizens, especially our elderly, who are cared for through the network of infirmaries in the local government system, have been prioritized for protection before and since the start of the pandemic. This has been made possible by the highly dedicated matrons and other managers and staff in the infirmaries. They too are frontline workers, and I must express our deep felt gratitude to them. In addition to a comprehensive range of health protocols that cover the activities of the residents and the service providers with whom they interact, visits by families have been disallowed since last year. These measures have proven to be highly effective, Madam Speaker, and we have had relatively few cases and very few deaths as a result. We are still living through a delicate phase of the pandemic, though, and as a result, the ban on visits to the infirmaries will continue. However, it is not the intention. We understand the emotional toll that this is taking both on the residents of the infirmaries and their families who would like to see them.
Don't forget to like, share, subscribe, and hit the notification bell. Select all for daily news updates.